tres.
Hi, my name is Alejandra Ponce, and today I'm gonna do a cap change on my patient, dressing change, and discontinuation. I'm gonna begin with the cap change first, so I'm just gonna get my things ready for that. So what I'm gonna need is a flash with 3 milliliters of normal saline and a cap, and I'm gonna be at the med room, and I would wash my hands, sanitize, and I would open my cap and keep it in the back so it's still sterile, and I would connect my normal saline and I would push it 0.5 mLs just to prime it. As soon as I see the liquid coming, that means I'm good. And so I'm ready to go to the patient to do my cap change. So I would bring this with me, and I would come in, knock, foam in, and introduce myself. Hi, Mr. Patient. My name is Alejandra Ponce, and I'm your nurse for today. And I'm gonna be doing a cap change on your central line, okay?
Okay.
Can you please tell me your name and date of birth, please?
My name is Edgar Mejia. My date of birth is today.
Okay. Now I'm gonna put, I already sanitized. I'm gonna put my gloves on because I'm gonna be assessing the site. And I'm gonna assess first my central line site. So I would start by visual. I'm gonna look for any redness, inflammation. I'm gonna check that there's no purulent drainage. That would be signs of infection. I will check that there's no malodor perceived, and there's no orbital edema, face edema, and nothing on the arm either. And then I would palpate to feel for any crepitus, which means there would be air in the interstitial space. And there's no blood coming out of the lines either. So no redness or anything, and no JVD. And so, okay, so the patient is good. And I asked the patient for pain. Do you feel any pain, sir? No, no pain. JVD. And also I would check for allergies. Are you allergic to anything?
No, miss.
Okay, so I already assessed my patient, checked for allergies, and now I'm gonna position my patient and get him ready for the cap change. So we need the patient to be flat. So I would remove the pillow so that the patient can lay flat on the bed, and I'm gonna bring the bed up to a good working position for me. And now I can start. So I'm gonna take a look at I'm gonna clamp all my ports. So I would clamp all 3 of them. And then also, Mr. Mejia, there's a point where I'm gonna ask you to turn your head on the opposite direction, and then I'm gonna also ask you to hold your breath, okay?
Okay.
Okay, so I would have my things right next to me at the bedside. So I would come in here, and I'm gonna choose the one that I'm gonna change, which would be this one. So I'm gonna go ahead and turn your head that way, okay? And then I'm gonna ask you to hold your breath. So I'm gonna grab my and I'm gonna ask you to hold your breath. So go ahead and hold your breath, and I'm gonna uncap it and connect the new one. And then you can proceed breathing, and then I'm gonna unclamp it, and then I'm gonna check for blood return. So I'm gonna aspirate, and as soon as I see blood return, that means it's working, it's patent, so I can now flush it. So I'm gonna flush it by the push and pause method. So I would push and pause the remaining 2.5 of the normal saline. So push and pause, push and pause, push and pause, push and pause until it all goes in. And then the remaining 0.5, I'm gonna clamp and push at the same time to create positive pressure right here in the line. So I'm gonna clamp and push at the same time, and then that's it. And then I'm gonna remove the flash, and then I'm gonna clamp my port with the sterile cap. So I would grab my sterile cap and I would close it. And I would finish by, I would do the same thing for all 3 ports, but for the demo purpose, I'll just do it with one. And I would clamp it, and I would finish by repositioning the patient, get him to a comfortable position with his pillow, and then ask for any discomfort. Do you have any pain? No, I'm okay. Okay. And put the bed down to the lowest position and take my gloves off and do hand hygiene. And that's it for this part of the demo, and we'll continue with the second part.